Let's take a look at some videotapes of infants who have met criteria for oral feeding readiness by earning 5 readiness scores of 2 or 1 in 24 hours. This is baby M. Baby M has an anatomical difference or defect called a cleft of the soft palate. At each baby's care time, as the nurse enters the bedside to take vitals and change the diaper, babies will be evaluated in terms of oral feeding readiness. As a reminder, oral feeding readiness scores of 3, 4, and 5 indicate that babies are not considered to be awake, alert, or organized enough to be offered an oral feeding. Babies earning a feeding readiness score of 2 or 1 are considered to be given the green light and are ready to accept feedings by mouth in a manner that is safe, efficient, and developmentally appropriate to their corrected gestational age. Baby M is a good example of a little one who earns a feeding readiness score of 2. As you can see, she's transitioning from sleeping to drowsy state, and now she is becoming alert with cares. Baby M is now nicely evolving into a quiet, alert state. She is bringing her hands and I think her thumb to mouth. She is calm with cares. She has some eye opening and is looking around. Baby M is showing a nice transition state. As with most babies, she's fussing a little bit with her diaper change and cares and is probably getting hungry now, moving from the active alert to crying state as she is showing some nice hunger cues with cares. Baby M is now doing some nice rooting against the collar of her sleeper. Visibly showing those nice, consistent feeding readiness cues. As baby M is laying in her crib, you can see she has a slightly small jaw, which is likely associated with the presence of the cleft of the soft palate that she has. Baby M has a nice active alert state. She's organized and calm. Hands are placed midline across her chest so that they can support her shoulders during her bottle feeding. Shoulder stability leads to jaw stability, which babies need for organized sucking, swallowing, and breathing. Most, though not all, premature babies will benefit from a modified side-lying position, which we'll review in caregiver techniques. Baby M has hands to mouth so that she can benefit from the strong oral feeding cues that she's showing us. She's sucking on her hands and licking. Those are all behaviors that say, "I'm ready to eat." Because she has a cleft of her soft palate, this is a special needs bottle called the Haberman Special Needs Feeder. It's often used with babies who have a cleft of the soft palate and have an inability to achieve adequate pressure within the mouth that's needed for achievement of suction, which is needed in sucking, swallowing, and breathing. Baby M easily latches on, producing several nutritive sucks. She is being provided with modified side-lying support, and she is also given cheek support to one side. During this bottle feeding, care is taken to keep her in alignment with her nose to toes position and providing her with lots of stability that will help her coordinate swallowing and breathing. Baby M is actively engaged in this feeding. Her eyes are open and calm. Her face appears comfortable, and she is free from any signs of avoidance or stress. Her eyes remain midline. She has no wrinkling of her forehead or nose, and she is easily accepting this bottle feeding with the supports that are provided. The caregiver feeding is able to provide slight compressions along the neck of the long nipple as needed to help assist with the flow of milk from the nipple, especially when babies have a cleft and they're having challenges achieving enough negative pressure within the mouth to achieve suction. Careful consideration of the flow of milk rate and timing it with nutritive sucking compressions is very important when using the specialty bottles such as the Haberman. Also, because baby M is premature, it's important to remember that she has an immature respiratory system, and keeping her in that side-lying position decreases the work of breathing so that she's comfortable and able to safely and effectively manage and coordinate her sucking, swallowing, and breathing. Now that baby M has had her cares and it was determined that she earned a feeding readiness score of 2 and the bottle was offered, let's discuss her feeding quality and some of the caregiver techniques that were used during this bottle feeding. As you may recall, the infant-driven feeding quality scales also has a rating scale from 1 to 5. Babies who earn a feeding quality score of 5 are in distress and unable to coordinate their suck, swallow, breathe pattern. Clearly, this did not happen to baby M. So let's move her up in the progression and talk about her feeding quality. Feeding quality scores of 4 are earned by babies when they have weak or inconsistent suck, swallow, breathe, and little to no rhythm. Despite the need for a specialty needs bottle, baby M really did not show any of those behaviors. Although she was fed with a mini Haberman or Haberman special needs bottle, she was able to maintain her coordination of sucking, swallowing, and breathing quite well with fairly little assistance from the caregiver feeding her. Babies earning a feeding quality score of 2 are those who nipple with a strong and well-coordinated suck, swallow, breathe, but get tired and fatigued with progression of the feeding. This was also not true for baby M. Babies earning feeding quality scores of 1 nipple with a strong coordinated suck, swallow, breathe throughout the entire feeding. Baby M earns a quality feeding score according to the infant-driven feeding scales of 1. She finished her whole feeding around 15 minutes and nippled with a strong and coordinated suck, swallow, breathe throughout the entire feeding. Although she became drowsy near the end of the feeding, she had no avoidance cues at any point during the feeding, had no loss of fluid from the corners of her mouth, and did not show any other signs of oral feeding disengagement, refusal, or distress. She remained physiologically stable throughout the entire feeding in terms of her heart rate, respiratory rate, and oral feeding behaviors, including her ability to manage sucking, swallowing, and breathing.